I find that as dentists we get exposed to a lot of different lasers and can almost be a little bit confusing as to what one is used where. I mean, I've got multiple lasers. You have them for soft tissue, hard tissue, but I specifically bought this one because the majority of my patient load that I see is for chronic pain patients, and I needed the anti-inflammatory and analgesic effects that this MLS laser gives us. I was very impressed with it. A little bit of selfishness in the beginning, because at the time when I started looking at it, I actually had a very severe plantar fasciitis myself, and I thought, oh, this might be good for me. And it was interesting. It definitely helped resolve that more efficiently and quickly. Definitely took the pain away whenever I did use it. And another thing that really convinced me at the time is we were having a little group meeting here, and you came and did a presentation, which I appreciated, and you had the laser with you, and we asked if anybody in the group had a trigger point, and one of the dentists said, oh yes, I've got one, and I palpated it and it was rock hard. And then you put that MLS laser on it for literally less than a minute, and I tested it again, and it was like it had just gone completely soft. So I went, oh my gosh, that's amazing. And it's interesting because trigger point injections are one of the therapies that we do for chronic pain patients, and the MLS laser has completely replaced that for me. I do not do trigger point injections anymore, so it's a much less invasive thing for the patient to experience. And you really get that beautiful resolution of it. And you prepare the tissue with the laser, so you're doing muscle contracture type treatments on it, but then you can do a specific trigger point, quasi trigger point injection technique on it as well, just to release that tissue and let it go. As chronic pain, dentists who treat chronic pain, we need a lot of different tools to help us. And this is a tool. It's not everything, but it is a very important tool for that resolution for the patients. They immediately feel like a weight has been lifted off them, and they feel a lot less tension in their muscles. And when you can create an environment for patients where they are no longer in that chronic pain, it becomes almost a rigor mortis type pain. This laser helps to bring everything that the body needs to heal it. The body's very capable of healing itself, so long as we provide the environment in which to do so. And the MLS laser is really helping us very, very well to achieve that. So I'm being extremely happy with it. The patients love it. Patient acceptance is great because it's so non-invasive, and they can immediately feel a reduction in their tension, and it's that tension that brings on the pain. Well, my practice is primarily, it's developed to help chronic pain patients and sleep apnea patients, and that's really my focus of my care. We use a lot of different techniques for the treatment of them, but that's the main majority of what I do personally. But we also have a general practice side as well, with Dr. Susan Gibbs is here as well. It's given me another tool to help my patients get well as quickly as I possibly can. I don't want people to be suffering a day longer than they need to be. We need to take the burden of the load that's on them away from them, and I believe that it's part of my protocol when I'm actually doing a workup on a patient, trying to get because we're repositioning jaws to be in a more comfortable position. When we're trying to find that position, I need everything going in favour for me. So part of that is using the laser to reduce the neck tension and back tension, and just let those muscles relax to a nice relaxed position. That, along with several other tools that I use. It's not a standalone tool for me, but it is definitely part of our protocol to get our patients well as quickly as we can. Well, again, it becomes a thing of getting the patient, the quicker you can get the patient better, that is the return on investment for both the patient and yourself. Because doing this work and having all the tools that we have, it's a very expensive procedure to actually be able to provide. But the quicker we can get people better, the more they have satisfaction, the more they have confidence that we're helping them, then those things are the return on investments, rather than a pure monetary gain from it. And as far as lasers go as well, from a cost investment point of view, it's in the mid-range rather than the high range that a lot of lasers are that we really fork out the money for. I think you need to think about where and how you're going to use it. I truly don't believe in just getting a tool and putting it in the back room and never using it. That's just not good investment, and it's really not giving the great benefit to your patients. So I believe that you should think about why you need and why you would want it. Certainly any practice that's treating TMD, I believe that this is a wonderful asset. Also the fact that it can accelerate the orthodontic treatment as well. That's also, almost an intangible, but again, a cost benefit factor associated with that. So, and there are often intraoral lesions as well. So this has an intraoral head that goes inside the mouth. If you've got pericoronitis, you've got ulcers, even dentine sensitivity, abfractions, things like that, it can desensitise through the analgesic and anti-inflammatory effects that the laser has. The fact that it really does have that nice effect, I always get a nice surprise and a nice feeling when patients get up and say, oh my gosh, I just feel, because you can't see it. You don't see the change happening, but they can feel it. And when you have not expressed to them an expectation, and they get up and say, oh, my head feels like, oh, that felt so good when you're doing the laser there. When they say those things to you, that gives you the endorsement that you're doing the right thing and not just hoping that, it's having an effect. So yes, it's very beneficial. It's all about understanding physiology. And as I said, if we create a good environment for our body in which to heal, it has everything it needs to do that healing. But often we don't create the space, we don't, the body's being adapted or maladapted to the problems, for example, malocclusion and things like that, where the jaw is not in a good position. Those muscles have to do a hell of a lot of work to hold it there. And that's the reality of structure and how it is. But if we can now bring in everything that the blood brings with it to start that healing process through the relaxation of that tissue and those analgesic effects, and that is a really big plus for the patient to be able to heal themselves.